There's a lot of attention recently around Aboriginal and Torres Strait Islander health with the Close the Gap launch, and which was around 2008. And this has been good in some ways because it shed a lot of light on the disparities between Indigenous and non-Indigenous Australia. Certainly some of the healthcare targets that have been set haven't been met, and some of them are going backwards in some areas. There's a mixed number of issues behind this. And certainly what James Cook University is doing in terms of recruiting and developing the Indigenous health workforce is being able to put Aboriginal and Torres Strait Islander people in the driver's seat and in leadership positions where they can take control of some of the issues and some of the self-determination processes that are needed, particularly around health, education and housing, employment opportunities. Building Indigenous people's capacities to take control of their own affairs is central to that. And that sort of brings me back to the concept of what universities should be concentrating on in terms of having some sort of social accountability in their curriculum. And it's sort of the area that I've taken a keen interest in. And now my current role, I'm also working as a GP. I fly to Charleville and I do 1 week a month out there. But I work full-time at Bond University where I'm where I implement the Indigenous health curriculum there, and I'm responsible for providing curriculum not only in medicine but also in nutrition and dietetics. There's an interest from my part to not only also develop Indigenous doctors and Indigenous allied health workers in the area, but also to provide Indigenous health education to all of our potential medical graduates, and giving them quality experiences where they can actually think about Indigenous health being a career pathway if they're interested, which we need. Certainly more people to take an interest in. We are getting to a point in the medical profession where working in cross-cultural difference and cross-cultural context is really important. A, for understanding that we're understanding where our patients are coming from, and B, making sure that we're getting them the right access to an appropriate diagnosis and the right investigations and the right follow-up and all these sorts of things. So working in the cross-cultural space is definitely an important thing, not only in healthcare, but you're probably seeing in a lot of industries. I think from when I studied medicine from where I am now and looking back, I think the landscape's changed a lot, and I don't class myself as that old. People are under a tremendous amount of pressure these days to try and perform, and some of this is a part of our social expectations as people. And I think the most important thing is that if we can find a niche or something that we're interested in, that will generate your learning, and a lot of drive can come from that. We're put into a box or a category where you're an OP 1 to 5, or therefore you have to do this or you have to do this. I don't think we should let ourselves play into that ideology. I think we should, if we have a passion in particularly around healthcare and in injustice and inequity and all those sorts of things that initially lit my spark, I think we should concentrate on that, and opportunities will naturally arise. I'm sure of it. Yeah.